I think we should move on. I'm gonna take the opportunity to introduce our speakers for tonight, as well as the moderators for tonight. I am Dr. Sarva Pathan. I and with my wife Farhin Pathan are the owners of Personalized Physical Therapy and Wellness, and Triad Lifestyle Medicine, Dr. Tiffany Allen and Leah Hazelwood. Uh, we both have collaborated together to allow this sharing of the knowledge for this afternoon, to allow the concerns of the bladder health and improve the health of the community. And we are bringing this presentation live for you guys. This is also recording, so if you know of your friends and family who wants to learn more about the bladder health and wants to get educated, feel free to share that video recording once we have that recording together for you. And if you guys have any questions, as we have already mentioned, feel free to let us know. But Dr. Tiffany Allen is going to start us off. She's the owner of Triad Lifestyle Medicine, located in High Point. She, with Leah Hazelwood, have a great practice that helps the community from the wellness perspective, as well as from physical assessments, their medical health, their overall functional balance, and holistic health. And so we're going to learn about bladder health from her, and then we're going to go over the 5 quick healthy bladder tips from Farhin Pathan, who is a physical therapist, and she has a background with doing research on over 65, 70 women, where she performed urinary incontinence based interventions to allow and to find what are better options for improving urinary incontinence, and did some comparative studies also. And she currently helps a lot of patients. Few of them are actually tuned in tonight, which is great. And so, without any further ado, I'll ask Dr. Tiffany Allen to please introduce yourself and share what you have for us for tonight. Thank you.
Perfect. Thank you, Dr. Savara. I appreciate it. Hey, everyone. I hope everyone's having a great day. And I'm going to just talk through here for a few minutes, a few points before I turn it over to Farhin. And we're so excited to be able to do this tonight. So I'm going to share my screen here. Give me just a second. Okay, perfect. So one of the things obviously that we're talking about tonight is bladder health. And here at Triad Lifestyle Medicine, it's not showing. Okay, hang on just a second. Technical issues. Go back into the Zoom. Okay. And go back to share screen. Okay, that's what I did wrong. Okay, perfect.
Perfect.
Okay, there we go. Sorry, guys. All right. As Dr. Savar said, I am the owner and nurse practitioner here at Triad Lifestyle Medicine. And we, at this clinic, what we're looking at is to help people from a different perspective than what you typically would see. So we're trying to look at ways how lifestyle factors affect your health. And this is one of the things with bladder health that, and we'll get into this a little bit more, but it's so important that if you've mentioned this to your provider in the past and maybe you've been brushed off, that's why it's important that we talk about some of these things tonight. So why are we talking about our bladder? So why is this a topic that we need to even discuss? Well, honestly, it is a common complaint. I would say that I hear this in our clinic on a daily basis of people of all types that are complaining with bladder issues, whether that be overactive bladder, not being able to hold your urine in like you used to be. All of those things are reasons why this is why we're talking about it tonight. So another thing is that I find that this can even be something difficult to bring up. No matter what age you are, it's not something that you necessarily want to talk about. So unless somebody specifically asks you, are you having incontinence? Are you having urinary urgency where you're feeling like you're having to run to the bathroom all the time? Like one of the participants already said, I'm in a store and I feel like I'm constantly having to go. But again, it's something that can be some level of embarrassment with it to talk about it. So that's why it's very important that we are here at the clinic, that we're asking people, is that something that you're having issues with? And if so, we help them address it and get to the right people, like Farhin, to be able to help them in the direction that they need to go. I feel like that we need to make this more of a normal instead of it being something that is an embarrassment, because again, it's something that our body does. I mean, we all have to urinate, obviously. And so it's something that, it's difficult to talk about some of these issues, because we do find that they have been more of a private concern, things that we don't talk about. But that's why I'm so excited about tonight, that we can actually get it out there and talk about it. So the other thing that I have found that has happened has been that people will tell me all the time that they have brought it up with their previous provider, and they basically say, well, it's just normal. After you have children, it's just a normal thing. Or as you age, it's just normal. There's really nothing that you can do about it. I would say that that happens 9 times out of 10, that people have said something, but it's just brushed off. So again, another important reason of why we're going to go in tonight and talk about bladder health. And then one of the other things is, who does this affect? And quite simply, it affects everyone. So it can be males, females, children, aging adults, all kinds. I mean, the entire spectrum. So basically, if you are alive and breathing, this issue affects you. And it's definitely something that we need to talk about. So, not only in females after you've had children, it can happen prior to that. And again, people sometimes feel like there's that level of embarrassment with it, which it should not be. So again, this is why we want people to know it affects everyone. It's the entire gamut of our lifetime. So when is a time that you should bring up and talk to your healthcare provider about bladder concerns? And basically, like some of the comments that have already been made, if your bladder routine is interrupting your activities or you're avoiding activities, that's a red flag. So that is a time that you would say, hey, I need to mention this and say there's something not right. Do you feel you go too frequently? Are you waking up multiple times throughout the night to go to the bathroom? Do you struggle with incontinence, even if it's a time that you're laughing, sneezing, playing, different activities that you may be doing? That's something you need to bring up. It's something you need to be aware of. The other thing, of course, is if you're actually having trouble with urinating, pain in the pelvic floor, all of those things are reasons of why you would need to be evaluated. And then, of course, with any changes that happen suddenly or over time, again, it's important that whoever you're seeing for your health care, that you bring it up. And you're aware, again, that there are people out there that can help you. So what happens if you bring it up to your healthcare provider? However, maybe you're dismissed. Maybe they say, hey, it's normal. Or maybe you were told only surgery is the option. You've got to have a surgery or medicine. So often there in our medical society, unfortunately, there can be quick fixes or band-aids that are put on things that aren't really taking care of the issue. So I want you to be aware that is something that may happen, that may come up. So again, be aware. Know that there are other options. Know that your lifestyle choices can play a big role into it. And I think that Farhin is going to go into that to some level, but realizing that, and I'm going to throw a simple thing out there, but caffeine can affect and stimulate the bladder. So if you're drinking coffee all day long and you're having urinary urgency, it could go hand in hand with that. So again, making sure that you're seeing someone that can analyze all of your lifestyle factors can play a huge role into bladder health as well. So we don't want to forget that key piece right there. And then, of course, which what we're going to talk about tonight, is physical therapy is a fantastic option with someone that has been trained specifically in pelvic floor management, which is Farhin is going to go into that tonight and tell us why that's so important. And again, I just want you guys and ladies to know that it's not something to be embarrassed about. It's something that we all need to talk about and know that there are options that are out there. So always know what your options are. So now I'm going to turn it over to Farhin to give us the bulk of the information for tonight. I'm so excited. Thank you, Farhin.
Thank you, Dr. Tiffany. I appreciate. Um, so this topic is very close to my heart because Sarvar mentioned, that I've done a research on incontinence, and I see women with these issues, and there has been, knowing or talking to them, I've learned that there is a lot of misconception around this area. People don't want to talk about it, and they've been told there's not much they can do, and a lot of time they just start to live with it and think that this is their new normal. But with the pelvic floor physical therapy, what we do is we evaluate your pelvic floor muscles. We see the posture, we see the breathing, because everything is connected and everything affects your pelvic floor and your bladder. So, as a pelvic floor therapist, my goal is to help women be empowered with the knowledge of their own body, be able to, continue their crazy lifestyles, their superwoman power that they already have, but without the fear of embarrassment or without the fear of leakage. And not having to cut down their activities just because they're worried that they might start to leak. Um, and I help women with one thing, leakage, when they're coughing or sneezing, or with lifting weights, or maybe lifting the grandkids or kids, or if they have a strong urge to urinate and before they can reach the bathroom they leak. I also help women with prolapse, which is very commonly called as organs falling out, or pain in the pelvic floor region, or pain with intercourse. And again, my goal is to help them get back to doing things without having this fear or embarrassment. um, and so today I'm going to discuss a little bit about the tips that you can apply right away, and then that will be helpful to you. But before we go into the details of it, I would like to show normal anatomy of the bladder and the physiology of the bladder, because that will help us understand those tips better. So this is the pelvis model, and I hope everybody can see it clearly. So this is the pelvis, that's a region between your trunk and the legs. And this is the region that stores, or it holds, your pelvic organs. So this is the bladder, that's the uterus, and this is the rectum right here. This is where the stool is stored, and the uterus where the baby is born, and the bladder which stores the urine. So we're talking a little bit more detail of the bladder. So I'm going to try to take it out of my model and show you here. Okay. So this is an elastic organ that stores urine, and I'm going to start sharing my screen to show one of the image.
While Farhin is sharing screen, I know Dr. Tiffany Allen described some of the details and whys behind the bladder program and bladder tips tonight. So if anyone has questions related, feel free to put it in the chat box while the presentation comes up.
Okay, so here we are. So in this picture, as you can see, this is the kidneys that produce urine, and these two tubes are called ureters, which drain the urine, and the bladder has the function of storing it. So on the picture and this image on the right, you can see that this area is where on the outside there is a detrusor muscle on the bladder, and this is called urethra, which is the end of, let me stop the yeah. So the end of this is called as a urethra, and it has two sphincters, which keeps it closed when we don't need to urinate. So there's an external sphincter and internal sphincter. The external sphincter is under your voluntary control. So, and that forms the pelvic floor muscle are a part of external sphincter. So how this normally function is, normally your bladder has a capacity of 400 to 600 ml of urine storage, which is about 2 to 3 cups of urine. And so when it's filled to a certain degree, there are receptors, sensory receptors in the lining of the muscle of the bladder that sends the signal to the brain. And then the brain sends you signal back when things are all good, you are near the restroom and you're sitting on the commode. It will tell you that, okay, this is a good time. And that's when your sphincters will relax and your pelvic floor muscle needs to relax when, and it will help open this opening, and then the urine can be passed. So if there is affection, and I'm going to share the screen again. Hold on, please.
While you're sharing
So if
screen,
there is, if
Farhin, while you're sharing
I'm back.
screen, I learned from Ellen on the chat box that she wasn't able to see any pictures. If you don't mind going to the top left and say, or maybe in the, yeah, from beginning or from current slide on the top left.
Okay.
From current slide, there you go. So that will bring the presentation much bigger and you'll be able to use the arrow keys to move around. Ellen, are you able to see the bladder picture and the kidney pictures now?
Well, Ellen wasn't the one that couldn't do it. Barbara Hendricks couldn't do it, but I got it now, and I have no idea how.
All right, perfect. Perfect.
Okay. And I can go over it real quick again. So this is a bladder which stores the urine, and whenever there is it is extended to a certain degree, when it's filled to a certain level, there's the sensory receptors that send you signals to the brain, and then the brain will let you know when the time is good. You can relax the sphincters, and then that's when the flow of urine, you will pass urine. So if any of this mechanism that we discussed is affected, then the leakage of urine can happen. So for example, when your bladder muscle is very overactive, that's when the leakage can happen. When your pelvic floor muscle, the sphincter, is not strong enough to hold the urine in or to keep the opening closed, and there is an increase in the intra-abdominal pressure, which is like when you're coughing or sneezing or lifting weight, there is more pressure in the abdominal region, and that's when the sphincters are not, this is not strong enough to keep it closed, and that's when the leakage can happen. Or if there is any blockage in this area, where there's the urethral region, if there's any blockage, maybe tumor, or in male, if there's prostate, then it is not going to let the urine completely empty. And that's when overflow incontinence can happen, where like there's a constant dribbling of urine because it keeps filling. And then when there's more pressure, it will dribble a little bit of urine. And then because of that obstruction, the whole thing, all the urine will not go out. So there will be overflow incontinence. So different kinds, like, if you have urge, or if it's because of stress, there are different reasons of incontinence, and the management will also vary according to what your symptoms are. So before we go into tip, let's take a quiz. I would like for you all to comment what is the normal amount of time during the day that you go to the bathroom to pee. And I'll give you minutes for everyone to respond to that, and then I'll give you what the normal frequency is.
Good. People are jumping right in. Makes sense. And looks like you guys are paying attention. I can sense.
Who wants to be the first to say how much you urinate?
Okay.
But I'll put it in my frequency. That's safe.
8, 2 to 3.
Good. 5 to 7, 2 to 3, 4 to 6. All right.
All right. Thank you, everyone, for answering that. And so let's go ahead and see what the normal frequency is.
Your screen sharing. Okay, there we are. Perfect.
Yeah. Here we go. Okay. Yes. So The normal number of times to urinate per day is between 6 to 7. And obviously, it depends on how much water you are drinking. It can also go to like 10 times if you're drinking more water. But this is for us to have a general idea of what the normal is. And this is according to bladder and bowel community, that it should be about 6 to 7. So let's go ahead and have the second quiz, which is what would be, what do you think is a normal flow? Ideal normal flow. And what I mean by that is, if you are urinating, how many seconds do you think is a normal to urinate? How much is too long, or how much is too short?
I'll say 10 seconds, maybe.
Trying to see. Okay, here we go. Let me see.
Yeah, people are all awake. They're not asleep yet.
12 seconds and 15 to 20 seconds.
Sorry, I don't know where and how to make my comments. Well, how does one do
The
that?
chat box at the bottom, you see chat. There's a little page square. Do you see?
Mine says more, and tap on more and chat pops up.
Oh, okay, well.
Oh, okay, you got to tap more for it to happen?
Yes.
Okay.
Yeah, maybe.
Oh, okay, all
Oh,
right.
okay, here we
No,
are.
I didn't know that.
Thank you.
Okay,
Thank you, Ellen.
Thanks.
thank you.
Okay, let's go ahead and see what the normal is. So sharing here. Okay. So it's about 7 seconds, 7 to 8 seconds is what is considered normal. And I'm going to, I think it's not going. Hold on 1 second, please. The technical issues here. Yeah, okay, got it. Okay, yeah, so the average stream of pee is 7 seconds. And why we are discussing this, you'll get a little bit more idea when we dive into our tips. So the first tip is that don't get into the habit of going to the toilet just in case. Only go when you need to go. So really listen to your body, because you know, in our lifestyles, we think that, okay, I'm going out for the grocery shopping, or I have a presentation, or I have a meeting, and I'm just going to go right now, so I don't have to go when I'm going out, or when I'm in whatever work I am. But what happens is, like we discussed, that bladder is an elastic organ. Consider it as a balloon. When you're not filling it completely, and say it has, you know, if it is just 80 ml, that you're filling it to 80 ml, and you're going every time at this level. Now because it is an elastic organ, it loses its elastic capacity, and this becomes the new normal. The receptors in the bladder, they get confused, and this becomes your new normal. And then when you make this as a habit, then your bladders, every time it fills to that level, the receptors will send the signal, and then you have to go again and again, and this will be your new normal. And a lot of patients of mine, they come and say, oh, I go 18 times a day, or I go 15 times a day, and that's what I think. I've started to live with it. But we can, what we do in that case is we can do bladder retraining, which is when you know what normal is, you'll be able to assure that you're not just going too often. So say, for example, if you're going 18 times in a day and you only pee for like 3 or 4 seconds, that means that's not normal, and you need to do something about it. You just got into a habit of going often, and that's what your new normal has become. The second tip is that don't hover using public toilets. So when you're hovering, on the public toilets. And I understand it's nasty sometimes and you don't want to sit on it, but you're causing more damage than benefit, because when you hover on it, you're not able to relax your, when you want to, for the normal mechanism, you want your pelvic floor muscles to relax. So those openings can, those sphincters can open. And when you're hovering, the pelvic floor muscles are supporting you. They cannot completely relax, and you're pushing against that. And you may not be even able to completely empty because it's not relaxing completely. So use the sanitizing wipes, use the portable toilet cover seats, but try not to hover when you're using the toilets. And avoid distraction. So using the phone while you're on the potty, or reading books. You don't realize that you are like in an abnormal posture, one thing, and the other thing is that you're squeezing or stressing the pelvic floor muscles. So you want to visualize those muscles relaxing. You want to connect with your body when you're doing your business. You want to not be distracted. As you can see, I hope everyone can see the image now. This is a squatty potty, and what this does is it's like a stool under your feet. It brings your knees up higher than your hips, and if you're resting your elbow on the thigh, it gives a posture which is like opening and not a kinking position for your rectum. So if you can see in this image, it shows how this person sitting more upright, while this person has this good posture, and the squatty potty can help you achieve that posture. And on the left side, you can see there's a kink, so you have to push. Versus on the right side, if you're sitting with that good posture, it's an easy passage of the stool, and you don't have to push against it. And when you're pushing, you're putting a lot of strain on your pelvic floor muscles. That's causing damage. One more thing that I would like to show with this model, so I'm going to stop sharing. Okay, is when you have from my model, the organs are falling out. Okay, so I'm just going to take it out for a showing purpose. Okay, so if you have that nice, good posture, usually there's a slight tilt in your pelvis. And
Farhin, because of the virtual background, it's hard to see the model. So if you want to keep it just right exactly in front of your body, not necessarily in front of the camera, but in front of your body, it would be visible. Or else, momentarily, we can remove the virtual background and then come back. So
yeah, how about, okay, let's just go. I'll try to show it on the and see if that will work. No,
not very clear. Yeah, it's
okay. Try to take the background.
bottom right. It says stop video. There's a arrow right beside it, and you click on the arrow. And it says choose virtual background. And then you can just say
Okay, so there's more, and
we hear a child in the background.
that's my 4-year-old. Yeah, so it says stop video.
Okay, so right beside the stop video, within the square, there's an arrow on top right, and you click on that arrow. Okay, let me be right there with you.
Sorry for the delay.
Right here. this area.
Okay.
And then you can say backgrounds, and then we can clean up. And then when you want to close,
Way better.
Okay. It isn't.
and then
There we go.
yeah, and
Okay. All right. Thank you. So here we go. This is the. Okay. So when you were having, this is like normally it would be it with a little tilt here with your neutral spine. So your organs, your pelvic floor organs or your pelvic organs are like supported on this front bone. This is called as a pubic bone. And so they are supported. But when you're slouching or you're like hunched over, now this is creating there's a tilt and everything is like is pushing or is the gravity now. So it's more pressure on your pelvic floor organ. So that's why sitting with a neutral spine and neutral posture is important, because then it's being supported by that bone versus it's now in that hole going down against the gravity. So squatty potty that's why recommended, because it just helps in avoiding that pressure and helps an easy passage of stool. And let's go to the next slide.
does that also answer the question related to like posture issues and bladder issues? How is that correlated? One of the participants asked that question about the posture issues affecting the bladder issues.
Yeah, so yeah, absolutely. So this is how, as we discussed, that if you have the good alignment and let me stop share so I can show that again. If it is aligned right, the organs are not going to like, if you're hunching, this is not like this, it's not at an angle, it's like this, more straight, and then it's putting more, all the organs are like against this pelvic floor muscle, they're pushing down versus being supported on this bone. Because when you have a good posture, it does have a slight tilt in a normal human body. It does have a slight tilt, and so they are not being pushed right on the bottom on these holes.
Makes
And
sense.
we're going to discuss a little bit more about this and the pelvic floor muscle when we go into the details of Kegel exercise.
Right. So
But-
basically, the organs should be supported on the bone rather than putting pressure on the pelvic floor muscles. Ideally.
Yes, and there is, yeah, and so if when you are sitting more hunched over, that's what it is called, creating to your pelvis and your pelvic floor muscles.
Makes sense. All right.
Okay, so we're continuing to our next tip, which is good hygiene practice. So urinate after sex. Both women and men should urinate after sex to flush away the bacteria that may have entered the urethra during sex. Don't use scented soaps or scrubs, perfumes to clean your vagina. Just use the fingers and water to clean. It's very sensitive area. So, you do not need the harsh products there. It's a self-cleaning area, so just use the warm water and the soap. Wear cotton underwear and loose-fitting clothes. Wearing loose cotton clothing will allow air to keep the area around the urethra dry, and tight-fitting jeans and nylon underwear can trap moisture and help the bacteria grow. So this is mainly for avoiding infections in the urinary tract. So the third tip is doing Kegels. And so I'm going to take a moment to do a little bit more detailed explanation here because this is my favorite part. So this is the these are the pelvic floor muscles. All here that you see is the pelvic floor muscle. The Kegels exercise that we talk about is this muscle. And then from the inside, if you can see, it's like a sling or the ball of muscle that goes from the front pubic bone to the back tailbone. And it support your organs. So its function is that it supports these organs up. And the other function is that it helps in opening. And when it's like it's relaxing, it's opening the sphincters, these three openings. And when it's contracting, it's squeezing. So this is urethra, where the bladder opening, where you pee. This is the vaginal opening, and this one is the anus. And these all part that you see is the pelvic floor muscle. And so that's why Kegel exercise is important to do, because it helps us support. And it's also a very important core muscle. So when you're doing, when you're standing up or walking, this muscle is helping. It's a part of your core muscle. It helps you provide stability. So when we discuss about Kegels, one thing that I want to point out is a lot of women do have like tight or tensed muscles in the pelvic floor region, and they might be having like pain with intercourse or urgency, which is like going to the urine, into frequency, which is like going to the bathroom again and again for peeing, or you have a strong urge. And so it might be that your pelvic floor muscles are not just weak, but they're very tight and tensed. And so if you are having that issue and you're doing pelvic floor muscle exercises and still not getting better, then you need to get evaluated by a pelvic floor therapist who can tell you if you have the tone issues, like it's a high tone versus there is only weakness. So you would like to get it treated first before you go do the Kegels. But for most of the women, Kegels exercises, and men too, the Kegels exercises is going to be beneficial. The only hard part is knowing if you're doing them right. So I'm going to attempt to see if you all can try with me and understand what exactly the Kegel exercise is. So if you consider that there is a tampon or a finger in your vagina and you're trying to squeeze that finger or the tampon, then you're doing that. Then the sensation that you will get is that the muscle is going up. It's going from the bottom, like an elevator, from the bottom floor to the top floor. And when you're relaxing it, it is going down. The other thing is like trying to close these openings, trying to stop or slow the flow of urine, or trying to stop the passage of gas. All these cues might help you know that that's the muscle that you need to work, and that's the Kegel exercise that we talk about. It does not mean clenching the butt. It does not mean that you're squeezing the thighs together. It's a very subtle movement that you're going to feel when you do it right. And when you do Kegels exercises, there are two important things. One thing is that you are working on holding. So you squeeze that pelvic floor muscle and you hold it so the maximum you want to go is 10 seconds. A lot of my patients, when I do the evaluation, they can only do for 3 seconds or 4 seconds, and that's okay. If that's where you are, you want to start there. You want to work on 3 seconds hold for multiple, like for 10 times. So for example, you're able to do 3 second hold. You want to squeeze, hold for 3 seconds, relax for 3 seconds, because relaxation is equally important. And then do 10 of those contractions 3 times a day. So it's total of 30 contractions. Once you know what this exercise is, it's very easy to do. You can do it sitting, like I can do it sitting right here. You can do it standing in a queue. You can do it while you're driving. So once you know what it is, it's easy to keep up with the exercises because it's easy to do. So one thing that I was mentioning was like holding is important. The other thing is fast contraction. So you want to work on speed, or you want to work on a quick contraction and relaxation. And why that is important is when you're coughing or sneezing, you want that muscle to be activating real quick, versus when you are walking or you're holding something, those muscle needs to continue to support you. So that's why one thing is holding, that's important. The other thing is like fast contraction is important. And so the recommended number of times that you should do is like I said, 10 contractions for holding 3 times a day, and 3 to 4 fast contractions when you're working 1 time a day. So that'll be about 12 contractions in a day. So let me pull up that screen again.
So the kegel seems to be, I think the general understanding, from my understanding, is that you're just basically contracting your pelvic floor muscles and then relaxing. However, it sounds like there are different varieties of muscle contractions that need to be focused on, as you described, the short flicker type contraction, then the long hold contractions, and then maybe based on power based exercises, it sounds like. Am I understanding it correct?
Yes. So pelvic floor muscles, like I said, that it does have a function of holding, like endurance. So you hold it for a few seconds and work on improving that seconds. Like you can hold for 3 seconds to start with, and then when the muscle strength improves, you can hold it to 4 seconds or 5 seconds. And you can go up to 10-second hold. And that is important for your everyday activities like walking, running, and because those muscles are able to support you. But then again, if you have leakage of urine when you're sneezing or coughing, that's the time too where there is increase in abdominal pressure and you start to leak, because these muscles are not strong enough to hold it up. So at that time, you want those muscles to activate quickly to close those openings so you don't leak. And so it's important to work on both the holding as well as the quick contractions.
Yeah. And then another thing that you described, which was really fascinating about the urge incontinence or urinary incontinence, was that kegels, yes, that helps with building up strength, endurance, power, but it's not always about strengthening, right? It's about sometimes that the muscles can be tight,
Yes.
and that can result into incontinence. So kegels in that situation, would that still help, or then you would need some more interventions, or how would that be resolved?
So yeah, it won't. So the thing is that if you have, I'll give you an example of a tight biceps muscle. If you have a tight biceps muscle and you keep working on strengthening this range, it's not going to benefit you, because you want it to completely open. If your function is that you want to go ahead and lift this bottle and drink, so you want the full strength. It's not going to give you that benefit that you need, because now your muscle is already tight and it's just doing you're doing this work right here, but you're not letting it completely not work in the full range, the optimal range that it needs to. So even for some people, it might even make their situation worse. And so you want to, if that's the case, you're not seeing the benefit of working with the pelvic floor exercises or Kegel exercises, then you do need to get it tested by a pelvic floor therapist who can evaluate if your tone is high, if you're not able to relax that muscle completely. So in that situation, we work on releasing the tension of that muscle. We work on helping them learn how to relax that muscle, get the full range of the muscle, and then we will work on doing the strengthening. So the strengthening would be a second stage, not the first.
Makes sense. All right. Thank you.
Thank you for the good question. Okay, let's continue with the presentation. Okay, yeah, the other thing that I wanted to add to this is NAC. NAC is a term that is used, which means is like when you are sneezing or coughing and you are the one who is leaking when you're sneezing or coughing, and you're working on Kegel exercises that will help you strengthen your muscle. But before you sneeze and cough, if you activate your pelvic floor muscle, this will help you stop leaking. And it will be an over the time, and you've already worked on strengthening it, but you will be able to activate that muscle prior to sneezing and coughing, and it will help you support or close those openings, and so you won't leak. So that's something you can try. Is if you have the issues of leakage, you can try of working on the Kegel exercise or activating your pelvic floor muscle right before you're sneezing or coughing. Other thing that, just staying active, like doing a 30 to 45 minutes of cardio or strengthening, will help you keep your BMI less than 25, which is like within normal. And obesity has, it creates a lot of, it pushes or creates more pressure on your uterus, on your bladder, on your pelvic floor, and it increases the problems. So if you do not have obesity, it will help you avoid these problems. So the next, my screen is shared, right? Okay, making sure. Yeah. So the fourth tip is drink well. A lot of patients that I've seen, or women that I've worked with, they say that just because they go to the bathroom often, or they don't want to keep leaking, they avoid taking the water or fluid. That is making your condition worse, because what it does is it concentrates the urine and it irritates the bladder and make the problem worse. So don't reduce your fluid intake if you have bladder problems. There are various research as to how much you should drink. According to the National Academics of Science, Engineering, and Medicine, they say a healthy man should drink about 3.7 liters, and a healthy woman should consume about 11.5 cups or 2.7 liters. There's a better thing that I feel is better, is to suggest to my patients that according to your own weight. So if you have 160 pound, if you weigh 160 pound, then divide it into half. That's 80. 80 ounces is what you should be drinking in a day. So that is more specific to your own weight, and that is something that you can easily check yourself, and that will help you know if you're drinking enough. Now, when we say that drink, well, that doesn't mean all the fluids. Some are irritants to your bladder, like coffee, carbonated soda, tea, and alcoholic beverages. Some acidic fruits like oranges, grapefruit, lemons, limes, and some fruit juices can also irritate your bladder. Constipation does affect your bladder and bowel function. If you often strain to move your bowels, the pelvic floor stretches and weakens over time, impacting the bladder control. So avoid constipation. One thing that I would want to add to this is, when we say try to avoid straining, what are the things that you can do if you do have constipation? Obviously, one thing is drinking water and eating, but the other thing you can do when you're sitting on the potty is try to rock back and forth or rock side to side. Take a deep breath and try to relax your pelvic floor muscle instead of pushing. So when you're taking a deep breath in, you want to relax your pelvic floor muscles. You want to visualize them going down and relaxing. And that will help in avoiding to strain while you have constipation. So eat plenty of fibers. This improves the bowel function by absorbing water and adding bulk to your bowel motions. Good source of fiber can include whole grain bread and cereals, barley, brown rice, oatmeal, beans, peas, apples, cabbages, and carrots. For snacking, try fresh or dried fruit, raw veggies, popcorn, whole grain crackers, or a handful of nuts. Women should be getting about 21 to 26 grams of fiber daily, depending on how much they eat. So it's about 14 grams for each 1,000 calories consumed a day. Eat 2 servings of fruits, 5 servings of vegetables, and 5 servings of cereals each day. So let's go ahead and take the questions here.
All right. Seems like uh, the questions that have been asked earlier, I'm going to run through those for now. And in the meantime, everyone who have questions or as they come up, please put it in the chat box. If you feel like you would like to actually describe your question, just unmute yourself and go ahead. This is the time, and you can use the knowledge and experience right here. I'm going to go from the initial questions first, and then I'm going to come to the other questions as I read in the chat box. We've talked about the posture issues and bladder issues, the urgency while running errands. How would you correlate that with the description that you've given? I think as you were describing about the kegels, I felt like that was the answer to it, but how can you control that urgency, or what happens and why does that happen?
So yeah, with the urgency, like we discussed that, when you get into the habit of going just in case, or you may not have developed that habit. It might be because your bladder has gotten oversensitive. And it is very common that it has triggers. Like when you're going to the grocery store, and then suddenly you have this trigger of I need to go to the restroom, or you're reaching home and your keys is in the hole, and you're trying to open the lock, and that's when you have a strong urge, and even before you can try it. So there are triggers associated with urgency. And what we do in that situation is, we would take a bladder diary, which will help us know in a day how many times you go to the bathroom, what were the triggers, and then we'll work on it. We call this like urge drills. We'll work on understanding what your triggers are, and then we'll work on giving you some strategies to avoid it. And you will have to. It's like some, I think. Karen, I'm sorry if I'm not pronouncing your name right, but you did ask if it is affected. Mind has to do with it, and it does. We have to. It's like training your bladder and your brain. That connection between them, retraining it again. And if you have these triggers, what I would suggest is try to take a deep breath in, try to work your kegels exercises, and try to distract yourself from that trigger. Try to think about something else, listen to the music, or do something else, and then avoid that time, or increase the duration of when you need to run to the bathroom a little bit. Like if you need to go right now, try to hold for 2 more minutes before you have to go, and that will help you avoid that urgency. And it does have the urge does work. I have seen my patients seen like tremendous improvement with it, and the triggers are there, and then you can work on having that connection again, retraining again. This is how I'm going to give you an example. It's just like your bladder is a baby in the grocery store who wants candy. And if you as a parent, which is brain, gives the candy to the kid, it's going to keep asking you. So that's when you need to like tell the bladder, no, it's not time yet, you can wait for a few minutes. And that's how it works with urgency.
Awesome. All right.
That answers.
Yeah. The next question is, what can you do to prepare your pelvic floor and bladder health pre-pregnancy and for lifetime health?
Well, that's a very good question. I'm working on it right now because I'm 22 weeks pregnant. And yes, women should start working prior and during the pregnancy to avoid the complications post-pregnancy. So Kegels are a great way of working if you don't have tightness and if you don't have issues of relaxation. Staying active, doing your exercises, doing Kegel exercises, one main important thing. They're doing deep breathing, because deep breathing, when you do a diaphragmatic breathing, it is like massaging your abdominal organs. It's it's also like calming your nervous system. It's massaging your abdominal organs, and it helps your pelvic floor function optimally. So doing a lot of like diaphragmatic breathing. And what I mean by diaphragmatic breathing is a lot of time we start to breathe from up here, like we use our neck muscles, we use this area a lot to breathe, but we want to breathe deep with the diaphragm muscle, which is the breathing muscle. And so the good way of doing it is you place your hands on your lower abdominal region, and you make sure that when you're taking a deep breath in, it goes out or it expands. And then when you're breathing out, it goes in. So that will help you, give you a feedback that you're using the diaphragmatic muscle and not you're using the upper trap and neck muscles to breathe. So yeah, you can do the deep breathing, you can do your regular, walking, pelvic floor muscle exercises, and then bridge is also a very great exercise. Pelvic bridging is a great exercise to do too.
Awesome. Maria asks about overactive bladder and incontinence.
Yeah, and so overactive bladder is what we were talking about, urgency. Is when you have an overactive bladder, it does affect your normal cycle, and then it is a very, it does sound like it's a concern if you're going through it for years, but the overactive bladder or urge incontinence is a very quick fix, more quicker than the stress incontinence is, because you're working on retraining your bladder. And so how you do it is you just learn what you are doing in an everyday activity. And this has been my personal experience and a lot of my patients too, that when you do the bladder diary, which is you just track how many times in a day you go, what all you drink and eat, and if you have had any leakages, and what were the causes, like if you were jumping, you were active, you were doing any activity, or what were the triggers, like if you have an urge incontinence or overactive bladder, what were the triggers. And once you have that picture in front of you, you have a better understanding of what your bladder is doing. And I know that somebody did say that there is 2 to 3 hours or 3 to 4 hours. So if you're normally your bladder takes about 2 to 3 hours to fill. So we want to get here, if you're going every 15 minutes or every half an hour or every hour, we will gradually work on reducing that duration or increasing the duration to 2 to 3 hours, and it's very much possible.
Awesome. Very good. Thank you. Next question is from Leah. She asks, how does childbirth contribute to bladder issues? Mom of 4 here.
Yeah, again, very good questions. Thank you for asking this good questions. Yes, so with pregnancy, one thing, when the baby is baby puts a lot of pressure on your uterus and your bladder and on your pelvic floor muscle. So they are in a constant stress. But when you go through the childbirth, if it's a vaginal delivery or a cesarean section, there is a lot of the muscle strain, muscle can rupture, and you lose the normal tone of your muscle. And that's how when you're losing, and also the hormones change, and so the level of hormones does affect too, and you will start to have leakage issues, and the pelvic floor muscle get affected, and that's when you start to see that you have all kinds of issues, like prolapse occurs very commonly in women after pregnancy, especially if they're starting to do more like they are not ready yet, and they start running or jumping, and that's when their muscles are not ready, they're not recovered from pregnancy, and then they do more activities like jumping, and that's when they cause more trouble and that's when the prolapse happens. So with even after pregnancy, you want to take it slow. You want to go ahead and do your rehab, your pelvic floor rehab, and take it slowly. When you're ready, that's when you need to go ahead and do the running and jumping. Otherwise, it can cause more damage.
Very good. The next question comes from Maria. She asks, not everyone may understand ml, which is equivalent to milliliters. And so how many fluid ounces? And I believe that ml was representing the volume of urine. Was that where the ml was talking about, or?
I think it was about the fluid intake in a day.
Fluid intake.
And I talk about dividing it according to your weight. So when you divide it, the pounds into half, whatever number you get is in ounces. So if it's 180 pounds, it's 80 ounces. 160 pounds, it's 80 ounces. So I think that would have answered her question. Please let us know if that's not the case.
All right. Yeah, Maria, feel free to put it in the chat. Amber Cornwell asks the next question. Remind me how you know the difference between the muscle, is it tight or needs strengthening?
Yeah, so, as a pelvic floor therapist, when we do evaluation, what I would do is I do my finger evaluation where I can have palpate the outside of the pelvic floor muscle and see if there's any tenderness in it. And then I insert the finger in the vagina, and then that helps me know if there's increased tone, there's tightness in the pelvic floor muscle. And that's how I would know if you have an increased tone or tightness. How you can know if you're not doing it right is if you have symptoms like inserting a tampon or anything or intercourse is painful, then that means you probably have tight muscles, and that might give you an idea. And when you're working on Kegel exercises or when you're trying to work on strengthening, and if you think that you're not able to completely relax that muscle all the way down, that's when you can gauge that you probably have the tightness. And I would recommend, try working on Kegel exercises. And if it's helping you, then you don't have to worry about it. But if your issues are more of pain and tenderness in that region, and if you have to go to the bathroom often, then you do want to make sure that if it is tightness versus just weakness. And a lot of times it's both. It's a combination of both. And so, when I do an evaluation, I will have a better idea of what your muscle is doing.
Awesome. Lynn asks the following 3 questions. The first one is, does decaf coffee also cause problems?
So, it's hard for me to, normally I wouldn't suggest my patients, or I would just say coffee is an irritant, and I don't tell you to stop because I know it's hard for people. But in general, yes, decaf coffee, it's not that you have to completely avoid it, but if you're the one who are taking it like in a day, several time, then that's something you might want to consider if this is causing you more problem. And that's why, water is considered better than this decaf coffee or coffee in general. So I'm sure decaf coffee is better than the caffeinated, but again, it's still an irritant to your bladder.
And 100% agree with me.
Okay. Thank you, Dr. Tiffany.
Tiffany, do you have more in detail regarding more nutrition side?
No, I think that was a great way to look at it. The one thing I did want to mention, which is completely sidetracking from the question that Lynn asked, but it was something that I thought about, is when you were doing the slide on constipation, that is something that can be a really big trigger for people with urinary issues, of course, and we don't necessarily put the two hand in hand. So just reminding you guys that I always recommend that if you're having issues with constipation, and you're getting plenty of fluids and you're eating the way that you like what your slide said, you're doing all of those things, don't forget like chia seeds and flax seeds, add into a smoothie, or to add those into something that you're eating, oatmeal, something like that, as it helps bulk up the stool for it to pass quicker. So that was just a tidbit of information that I thought I'd share into that, but otherwise everything looked great.
Thank you. Yeah, please feel free to talk a little bit more detail about the diet issue, because you're an expert in that.
Yeah, that was great. So, but with the
There is one more related to diet. Tiffany, if you want to answer this, it says, do you recommend drinking water throughout the day or with just meals and snacks?
I recommend throughout the day. I mean, at least for me, I'm not going to be able to get all of my water intake, which would be like Farhin said, I recommend half of your weight is what you're drinking for water intake in ounces. So I say throughout the day, that's at least what I practice with myself. That's what I tell my patients to do. So I think it's okay to do a little bit of both.
Awesome. So Lynn also asks, Farhin, what would cause urine flooding, large amount leak while walking?
Yeah, so that would be one thing, that your pelvic floor muscles might be very weak. And, with the walking, we do put a lot of pressure when we're walking. There is a constant impact. When your heel is striking with the ground, there's a constant impact that goes up to the pelvic floor muscles. And so a lot of time with walking, women can experience the leakage of urine. And that's the main thing, is that if your pelvic floor muscles are not strong enough, if your your posture is also important while you're walking, or your breathing, that you're making sure that you're having a nice deep breaths and you're not holding your breath. I wouldn't recommend that you try to squeeze your muscle while you're walking, because that's not how it usually works. It needs to like relax and contract while you're walking. So don't try to just squeeze your pelvic floor muscles while you're walking. But with the walking, another thing that I would like to mention is like changing the surfaces of walking will help a lot of times. That you're not walking on a hard, maybe treadmill would be a more impactful, or on a hard surface on a road, versus change it to walking on a grass, or change it to walking on a soft sand. And that will assist in reducing or changing that impact on the muscle.
Awesome. Very good. Well, that concludes the questions. And I think there's one more question regarding the presentation, which is certainly, Jane, we can send it to you. Farhin, if you don't mind bringing the offer up, we have a special offer for all the participants tonight that are tuned in live here, and gives them the opportunity to find out more in detail about the issues that they may be having or that have been answered. And what this is an offer that is only exclusive for you guys who are tuned in. And that is a personalized physical therapy evaluation and a comprehensive wellness assessment. And what does that include? That includes a bladder and lifestyle audit, as Farhin described, about all of the bladder diary and the training, then leak-free future roadmap. So we design how they are gonna give you that map of how you're gonna get that leak-free experience. Doctor's report of finding, going into the details, and then a home body rejuvenation program. So getting an actually exercise program for you yourself, and allowing yourselves to become, have that program for yourself, plus a 24/7 access to doctor physical therapy. You get, full messaging center. We have a special app that we have special access to, a live feedback on your movement form, kind of going over specific exercises and making sure that you're doing it correctly, and then real-time adjustments to your routines. And not only that, included in the comprehensive wellness assessment, Farhin, if you don't mind changing the slide for me. And in the comprehensive assessment, you will get a detailed health assessment, a physical assessment, lab recommendations that might be necessary in case when we go through the testing, medical guidance, and if medications are necessary, they can be prescribed. Otherwise, we would be pricing it at 549 value, but just for the attendance tonight, the price is only 249. So whoever wants to sign up, like for you to just say, you can put it in the chat, say yes, or and put your phone and email, and we'll reach out to you for getting you scheduled. But any other questions that are for tonight, feel free to ask. Thanks, Lynn, for asking those questions for us. Any specific questions that is needed for tonight?